The nurse is caring for a patient with heart failure who is experiencing dyspnea. What is the priority nursing intervention? A. Administer diuretics as ordered. B. Assess the patient's lung sounds. C. Place the patient in high Fowler's position. D. Notify the physician. The answer is C. Place the patient in high Fowler's position. Elevating the head of the bed helps relieve dyspnea by promoting lung expansion. A nurse is delegating tasks to a nursing assistant. Which task is appropriate to delegate? A. Assessing a patient's pain level. B. Documenting a patient's intake and output. C. Administering a medication. D. Performing a sterile dressing change. The answer is B. Documenting a patient's intake and output. Documenting intake and output is a task that can be delegated to a nursing assistant. A patient who is 2 days post-operative from abdominal surgery reports pain. Which action should the nurse take first? A. Administer prescribed analgesia. B. Assess the surgical site. C. Reassure the patient that pain is normal. D. Notify the healthcare provider. The answer is B. Assess the surgical site. Assessing the surgical site is essential to determine if there are complications contributing to the pain. Which patient should the nurse assess first in a busy emergency department? A. A patient with a sprained ankle. B. A patient with a headache and nausea. C. A patient with chest pain radiating to the left arm. D. A patient with a laceration requiring stitches. The answer is C. A patient with chest pain radiating to the left arm. Chest pain with radiating symptoms is a potential sign of a myocardial infarction and requires immediate assessment. The nurse is caring for a patient with diabetes who has a blood glucose level of 400 milligrams per deciliter. What is the priority action? A. Administer the prescribed insulin. B. Recheck the blood glucose in 30 minutes. C. Encourage fluid intake. D. Notify the physician. The answer is A. Administer the prescribed insulin. The rationale is that the priority is to manage the hyperglycemia by administering insulin as ordered. A nurse is supervising a new graduate nurse. Which action requires immediate intervention? A. The new nurse checks vital signs on a stable patient. B. The new nurse delegates a task to a nursing assistant. C. The new nurse administers medications without verifying allergies. D. The new nurse provides patient education. The answer is C. The new nurse administers medications without verifying allergies. The rationale is that confirming allergies is critical to patient safety before medication administration. A nurse is caring for a patient with pneumonia. Which finding would require immediate attention? A. Fever of 101 degrees Fahrenheit. B. Productive cough with yellow sputum. C. Oxygen saturation of 88%. D. Complaints of fatigue. The answer is C. Oxygen saturation of 88%. The rationale is that an oxygen saturation below 90% indicates inadequate oxygenation and requires immediate intervention. A nurse is planning care for a patient with a new colostomy. Which intervention is a priority? A. Educate the patient about diet modifications. B. Monitor the stoma for color and integrity. C. Discuss the importance of regular follow-up. D. Provide emotional support. The answer is B. Monitor the stoma for color and integrity. Ensuring the stoma is healthy is critical to the patient's recovery and function. The nurse is assigned to a patient who is 4 hours post-operative from a hip replacement. Which assessment is most important? A. Pain level. B. Neurovascular status of the affected leg. C. Surgical site appearance. D. Patient's ability to ambulate. The answer is B. Neurovascular status of the affected leg. Monitoring neurovascular status is crucial to identify complications such as compartment syndrome. The nurse is caring for a patient with a history of substance abuse who is now in detox. Which patient behavior is concerning? A. Complaining of nausea and vomiting. B. Asking for higher doses of medications. C. Exhibiting mood swings. D. Requesting additional fluids. The answer is B. Asking for higher doses of medications. This behavior may indicate a relapse or potential misuse of medications. A nurse is caring for a patient with severe anxiety. Which intervention should the nurse implement first? A. Administer prescribed anxiolytics. B. Establish a therapeutic relationship. C. Encourage deep breathing exercises. D. Provide education on coping mechanisms. Answer: B. Establish a therapeutic relationship. Rationale: building trust is essential to effectively manage anxiety and provide subsequent interventions. Which instruction is most important? A. Maintain a low-salt diet. B. Monitor blood pressure daily. C. Exercise regularly. D. Take medications as prescribed. Answer: D. Take medications as prescribed. Rationale: adherence to medication is critical in managing hypertension effectively. Which findings should the nurse monitor for? A. Fever. B. Rash. C. Chills. D. Shortness of breath. Answer: A. Fever. Rationale: fever can indicate a transfusion reaction requiring immediate assessment. A patient who is receiving opioids for pain management reports constipation. Which intervention should the nurse implement first? A. Administer a stool softener. B. Encourage increased fluid intake. C. Assess bowel sounds. D. Educate the patient on dietary fiber. Answer: C. Assess bowel sounds. Rationale: assessing bowel sounds is crucial to determine if there is a significant issue before implementing a treatment. Which result is most concerning? A. Potassium level of 5.5 mg/L. B. Sodium level of 140 mg/L. C. Bun level of 30 mg/dL. D. Hemoglobin level of 12 g/dL. Answer: A. Potassium level of 5.5 mg/L. Rationale: a potassium level above 5.0 mg/L can lead to life-threatening cardiac arrhythmias. What is the most appropriate nursing intervention? A. Encourage the patient to talk about their feelings. B. Provide a quiet environment and stay with the patient. C. Administer prescribed antidepressants. D. Suggest the patient take a walk. Answer: B. Provide a quiet environment and stay with the patient. Rationale: creating a calm environment and being present can help reduce anxiety during a panic attack. Which patient should the nurse assess first? A. A patient with stable angina who is experiencing chest pain. B. A patient with a recent stroke who is having difficulty swallowing. C. A patient with pneumonia who has a productive cough. D. A patient with diabetes who is complaining of increased thirst. The answer is B. A patient with a recent stroke who is having difficulty swallowing. The rationale is that this patient is at risk for aspiration and needs immediate assessment. Which patient is the priority for the nurse to assess in a crowded clinic? A. A patient with a rash who is stable. B. A patient with a sore throat who has difficulty swallowing. C. A patient with a sprained wrist. D. A patient with a mild headache. The answer is B. A patient with a sore throat who has difficulty swallowing. The rationale is that difficulty swallowing can indicate a more serious condition such as an obstructed airway. A nurse is teaching a patient about the signs of infection after surgery. Which statement by the patient indicates a need for further teaching? A. I should watch for redness or swelling at the incision site. B. If I have a fever, I will call my doctor. C. I will look for yellow drainage as a sign of healing. D. I should monitor for increased pain or tenderness. The answer is C. I will look for yellow drainage as a sign of healing. The rationale is that yellow drainage can indicate infection. Clear or light yellow drainage may be normal. Which action should the nurse take first? A. Administer epinephrine. B. Call for help. C. Assess vital signs. D. Start oxygen. The answer is A. Administer epinephrine. The rationale is that epinephrine is the first-line treatment for anaphylaxis and should be administered immediately. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease or COPD. Which finding is most concerning? A. Respiratory rate of 22 breaths per minute. B. Oxygen saturation of 88% on room air. C. Use of accessory muscles for breathing. D. A productive cough with clear sputum. The answer is B. Oxygen saturation of 88% on room air. The rationale is that an oxygen saturation below 90% is concerning and indicates the need for immediate intervention. A nurse is planning care for a patient with a deep vein thrombosis or DVT. Which intervention is a priority? A. Encourage ambulation. B. Apply warm compresses to the affected leg. C. Administer anticoagulant therapy as prescribed. D. Monitor the patient's vital signs. The answer is C. Administer anticoagulant therapy as prescribed. The rationale is that anticoagulant therapy is crucial to prevent further clot formation and complications. Which finding is most indicative of a stroke? Is it A. Sudden severe headache, B. Nausea and vomiting, C. Unilateral weakness in the arm, or D. Blurred vision? The answer is C. Unilateral weakness in the arm. The rationale is that unilateral weakness is a classic sign of a stroke and requires immediate medical attention. Which task can a nurse safely delegate to a nursing assistant? Is it A. Assessing a patient's pain level, B. Assisting with a patient's bath, C. Administering medications, or D. Evaluating a patient's lab results? The answer is B. Assisting with a patient's bath. The rationale is that assisting with personal care is within the scope of practice for nursing assistants. A nurse is caring for a patient with a history of heart failure. Which symptom requires immediate evaluation? Is it A. Weight gain of 2 pounds in 1 day, B. Mild edema in the lower extremities, C. Increased fatigue during activities, or D. Occasional palpitations? The answer is A. Weight gain of 2 pounds in 1 day. The rationale is that rapid weight gain can indicate fluid retention and worsening heart failure. A nurse is caring for a patient with a new colostomy. Which patient's statement indicates a need for further teaching? A. I will empty the bag when it's 1/3 full. B. I can eat anything I want now. C. I need to monitor the stoma for changes. D. I should keep the area around the stoma clean and dry. The answer is B. I can eat anything I want now. The rationale is that dietary modifications are often necessary after a colostomy. Further education is needed. What is the priority nursing intervention? A. Teach the patient about carbohydrate counting. B. Assess the patient's understanding of diabetes. C. Schedule a follow-up appointment. D. Provide a list of diabetic-friendly foods. The answer is B. Assess the patient's understanding of diabetes. The rationale is that understanding the condition is crucial for effective self-management and education. Which lab result is most concerning? A. Creatinine of 2.0 milligrams per deciliter. B. BUN of 40 milligrams per deciliter. C. Calcium of 8.5 milligrams per deciliter. D. Potassium of 6.2 milliequivalents per liter. The answer is D. Potassium of 6.2 milliequivalents per liter. The rationale is that hyperkalemia can lead to serious cardiac complications and requires immediate intervention. A patient is being discharged after a myocardial infarction. Which statement indicates the need for further teaching? A. I will stop smoking immediately. B. I can resume my normal diet right away. C. I will take my medications as prescribed. D. I should contact my doctor if I have chest pain. The answer is B. I can resume my normal diet right away. A heart-healthy diet is important after a myocardial infarction, indicating the need for further education. A nurse is caring for a patient with a respiratory infection. Which assessment finding is most concerning? A. Increased respiratory rate. B. Productive cough with green sputum. C. Oxygen saturation of 90%. D. Mild fever. The answer is C. Oxygen saturation of 90%. An oxygen saturation of 90% indicates hypoxemia and requires immediate attention. A nurse is caring for a patient who has just undergone a total hip arthroplasty. Which intervention is a priority? A. Monitoring for signs of infection. B. Encouraging deep breathing exercises. C. Ensuring the patient follows hip precautions. D. Providing pain management. The answer is C. Ensuring the patient follows hip precautions. Preventing dislocation is crucial after hip surgery, making this the priority intervention. A nurse is teaching a patient with hypertension about lifestyle changes. Which statement indicates that the teaching was effective? A. I can continue to eat as much salt as I want, as long as I take my medication. B. I will start exercising for at least 30 minutes most days of the week. C. I can drink alcohol as long as I limit it to 1 drink per day. D. I will monitor my blood pressure weekly. The correct answer is B. I will start exercising for at least 30 minutes most days of the week. Rationale: regular exercise is a key lifestyle change for managing hypertension. Which sign should the nurse look for? A. Positive Murphy's sign. B. Positive Brudzinski's sign. C. Positive Homan's sign. D. Positive McBurney's sign. The correct answer is B. Positive Brudzinski's sign. Rationale: Brudzinski's sign is indicative of meningeal irritation, which is a sign of meningitis. A nurse is caring for a patient who has just received a new prescription for warfarin. What is the most important teaching point? A. You can take over-the-counter medications without checking. B. Avoid foods high in vitamin K. C. You need to monitor your blood sugar regularly. D. You can stop the medication if you feel better. The correct answer is B. Avoid foods high in vitamin K. Rationale: vitamin K can interfere with warfarin's effectiveness, so patients should be educated about dietary restrictions. A nurse is caring for a patient with a history of alcohol use disorder who is experiencing withdrawal symptoms. Which symptom is most concerning? A. Tremors. B. Sweating. C. Seizures. D. Anxiety. Answer: C. Seizures. Rationale: seizures can be life-threatening and require immediate intervention in the context of alcohol withdrawal. A nurse is caring for a patient with a pressure ulcer. Which intervention should be included in the care plan? A. Reposition the patient every 4 hours. B. Use a donut cushion for pressure relief. C. Keep the ulcer area moist. D. Assess the ulcer size and condition daily. Answer: D. Assess the ulcer size and condition daily. Rationale: regular assessment is crucial for monitoring healing and adjusting the care plan as needed. Which statement by the patient indicates a need for further teaching? A. I will check my blood sugar before surgery. B. I can eat a regular meal before the surgery. C. I will inform the nurse if my foot looks red or swollen. D. I need to avoid smoking before the surgery. Answer B. I can eat a regular meal before the surgery. Rationale: patients may need to fast before surgery, indicating a need for education on preoperative guidelines. A nurse is caring for a patient with a history of chronic pain. Which intervention is essential for pain management? A. Administer pain medication only on request. B. Use pain assessment tools regularly. C. Discourage the use of complementary therapies. D. Focus solely on pharmacological interventions. The answer is B. Use pain assessment tools regularly. The rationale behind this is that regular assessment of pain is crucial to effective pain management and treatment evaluation. A nurse is teaching a patient about the importance of regular follow-up appointments after a cancer diagnosis. Which statement by the patient indicates understanding? A. I will only go if I have symptoms. B. Follow-up appointments are important to monitor for recurrence. C. I can skip appointments if I feel fine. D. I only need to see my doctor once a year. The answer is B. Follow-up appointments are important to monitor for recurrence. The rationale here is that regular follow-up is crucial for early detection of recurrence and managing ongoing care. A nurse is caring for a patient with an exacerbation of asthma. Which intervention should the nurse implement first? A. Administer bronchodilator therapy. B. Assess the patient's peak flow. C. Provide education on inhaler use. D. Encourage the patient to relax. The answer is A. Administer bronchodilator therapy. The rationale is that immediate bronchodilator therapy is critical for relieving acute asthma symptoms. A nurse is teaching a patient about the side effects of a new medication. Which patient's statement indicates a need for further teaching? A. I should watch for signs of bleeding. B. I can stop taking the medication if I feel side effects. C. I need to report any unusual bruising. D. I should take the medication at the same time each day. The answer is B. I can stop taking the medication if I feel side effects. Rationale. Patients should not stop medications without consulting their healthcare provider. A nurse is caring for a patient with a history of depression. Which behavior indicates a potential suicide risk? A. Increased social interactions. B. Sudden calmness after a period of agitation. C. Expressing feelings of hopelessness. D. Compliance with medication regimen. The answer is B. Sudden calmness after a period of agitation. Rationale. This may indicate the patient has made a decision to act on suicidal thoughts and requires immediate assessment. A nurse is preparing to administer a medication via a nasogastric tube. Which action should the nurse take first? A. Check the placement of the tube. B. Crush the medication. C. Flush the tube with water. D. Administer the medication. The answer is A. Check the placement of the tube. Rationale. Confirming tube placement is critical to ensure medication safety and effectiveness. Which intervention is a priority? Is it A. Encourage oral intake. B. Administer intravenous fluids as prescribed. C. Monitor blood glucose levels. Or D. Provide education about dietary modifications? The answer is B. Administer intravenous fluids as prescribed. The rationale is that fluid resuscitation is crucial in the management of acute pancreatitis to prevent complications. Which symptom should the nurse monitor for? Is it A. Weight gain, B. Cold intolerance, C. Increased heart rate, or D. Hypotension? The answer is C. Increased heart rate. The rationale is that tachycardia is a common symptom of hyperthyroidism and needs to be monitored closely. A nurse is teaching a patient about managing gastroesophageal reflux disease, or GERD. Which statement indicates a need for further teaching? Is it A. I will eat smaller, more frequent meals. B. I can lie down immediately after eating. C. I should avoid foods that trigger my symptoms. Or D. I will elevate the head of my bed while sleeping. The answer is B. I can lie down immediately after eating. The rationale is that lying down after meals can exacerbate GERD symptoms and should be avoided. A nurse is assessing a patient with a history of seizures. Which finding is most concerning? Is it A. Auras before a seizure, B. Loss of consciousness during a seizure, C. Postictal confusion, or D. Seizure lasting more than 5 minutes? The answer is D. Seizure lasting more than 5 minutes. A seizure lasting longer than 5 minutes requires immediate medical intervention due to the risk of status epilepticus. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease or COPD, who is experiencing worsening shortness of breath. What is the priority intervention? A. Administer bronchodilator therapy. B. Provide education on smoking cessation. C. Assess the patient's oxygen saturation. D. Encourage the patient to cough and deep breathe. The answer is A. Administer bronchodilator therapy. Immediate administration of bronchodilators is essential for relieving acute respiratory distress. A patient with diabetes is scheduled for surgery. Which statement by the patient indicates a need for further teaching? A. I will stop taking my insulin the night before surgery. B. I will monitor my blood sugar closely before surgery. C. I will inform my surgeon about my diabetes. D. I should fast according to the preoperative instructions. The answer is A. I will stop taking my insulin the night before surgery. Patients must continue insulin unless directed otherwise by their healthcare provider, as managing blood sugar is crucial around the time of surgery. A nurse is caring for a patient with a history of heart failure who is experiencing edema. Which intervention should the nurse implement first? A. Weigh the patient. B. Administer a diuretic. C. Assess the patient's vital signs. D. Elevate the patient's legs. The answer is C. Assess the patient's vital signs. Assessing vital signs is essential before implementing further interventions to monitor the patient's status and guide treatment. This set of 50 Nclex style questions emphasizes delegation, prioritization, and critical thinking in nursing practice. Remember to practice regularly, as familiarity with the Nclex format and content can significantly enhance